Brennan in for Jessica Moore. Some doctors say they're reaching a breaking point as they treat a rising number of children with the viruses. CBS 2's Lisa Rosner has more on the demand that the federal government get involved.
Cohen Children's Medical Center at Northwell Health has added more than 75 pediatric beds, using every available space to treat children having trouble breathing due to RSV.
Things are getting tight. Critical shortages of nurses and physicians around the country who are specialists in pediatric emergency medicine really challenge our ability to respond to this event.
Typically, the hospital sees 200 admissions a day, but in the last few weeks, the chair of pediatrics says they're seeing 300 a day. In his nearly 40 years of practicing, he says he's never seen a surge like this.
These babies that were born over the last year and a half probably did not have a rise in antibodies. That may be one of the reasons.
Some doctors are calling it a triple-demic, since symptoms are similar to COVID and the flu, and those cases are also on the rise. That's why Sunday, U.S. Senate Majority Leader Chuck Schumer called on the U.S. Department of Health and Human Services to be at the ready to send additional medical staff from other states, provide additional breathing equipment if needed, and help medical providers expand the use of telehealth.
Doctors can see many more patients online, one after the other, without the patients coming into the emergency room. And telehealth can also ensure worried parents speak to a provider right away.
Dr. Munib Khan at MiDoctor Urgent Care says severe symptoms that he may refer someone to the hospital for include fever, wheezing, difficulty breathing, and a bluish discoloration of the skin on the lips and nails due to low levels of oxygen.
Common symptoms can include anywhere between nasal congestion, a dry cough, sore throat, headache, sneezing. If you have RSV, you can contract COVID.
He says testing is key, and with one nasal swab like this, the team can test for RSV, COVID, and about a dozen other viruses that can cause the common cold. We reached out to HHS for comment on Schumer's proposal, but did not hear back. On the West Side, Lisa Rosner, CBS 2 News.
Now, the CDC says only about 2% of children younger than 6 months are hospitalized for RSV, and most make a full recovery.